2 weeks ago, News Talk 92.3 KTAR broadcasted live from SARRC for our 7th annual Action for Autism Radiothon. As we built up towards the end of the day, the energy in the room was electric. The phones were ringing off the hook, and the on-air interviews with our families had us bursting with pride. But then, Danny Portillo walked into the room, and the room went silent. Danny is a single father of 4 children, 3 of whom were with him that afternoon. My 8-year-old son, Danny Jr., has autism, Portillo said. We were listening to the radio and wanted to help. In the palm of the hand of his 13-year-old son was a crumpled up $5 bill. KTAR put him on the radio immediately, where we learned that Danny Jr. was nonverbal, engaged in severe headbanging behavior, liked playing with strings and had one with him that day, and was still in pull-ups. That moment was a painful reminder of the many gaps that still exist in our mission to advance research and provide a lifetime of support for individuals with autism and their families. Since 1997, our community has invested in SARRC, and SARRC has been innovative in leveraging your investment to not only close gaps, but produce broad social impact. Here are a few of my favorite social innovations. First, the community school. Since receiving a 3-year state appropriation in 2006, the community school has quadrupled the number of classrooms, increased capacity from 12 to 60 students, and is financially sustainable, no longer requiring any state funding. Over the last 4 years, 75% of our pre-K students have transitioned to mainstream kindergarten, reducing special education costs for our state. And our typically developing kids, they're making up to 18 months progress in 10 months' time on their language development, demonstrating that the community school is so much more than just a treatment program for autism. It's a model for effective early childhood education. Second, Autism Community Works. The Arizona Diamondbacks and the Pulliam Charitable Trust have helped us launch Autism Community Works to provide teens with autism with early employment experiences, but they expected a social return. And I'm proud to tell you that last month we learned that they got one. The federal government of Canada has committed $11.4 million over the next 4 years to expand Community Works in 6 different sites across Canada, impacting 1,200 Canadian teens per year. SARRC will license the program to them and provide the training. Through local partnerships with libraries, museums, gardens, and animal shelters, our teens are working alongside their typically developing peers and volunteering throughout our community and soon across Canada's. Third, Think Asperger's. Through the support of a generous donor, SARRC has developed and validated the DAVE screening tool, detecting Asperger's very early. And today, more than 1,000 screening kits have been distributed. We've also trained 292 nurse practitioners, 93 pediatric residents, 63 first-year medical students, and 522 educational professionals across 18 districts and 13 schools. Best of all, as we continue to help parents, education, and medical professionals think Asperger's, they can go online, download the screener, fill it out, send it into SARRC, and start getting some answers. And finally, SARRC has leveraged a 2-year, $60,000 research grant to evaluate web-based technology for providing support to the rural areas into a $2.2 million National Institutes of Health grant to design an app for accelerating diagnosis of autism. Not only have the Marley Foundation and the Gila River Indian communities allowed us to serve more than 232 families through our remote parent training program, but our use of the technology has led to partnerships with Behavior Imaging Solutions and Georgia Institutes of Technology. And together we're going to help physicians from any location, when they suspect autism, have families go online, download the Naturalistic Observation Diagnostic Assessment app, and get some answers. But the Portillo family that day taught us that there are still more gaps to fill. First and foremost, we need to lower the age of diagnosis for autism to maximize the promises of early intervention. We can diagnose autism between 18 months and 2 years of age, yet the average age of diagnosis in Arizona is 4 years, 11 months. And if you're an Hispanic family like the Portillos, it's going to, on average, take you 3 times as many visits to get a diagnosis. Danny Portillo, at 8 years old, nonverbal, wasn't identified until he arrived for kindergarten. We believe that if we start even earlier, we may even be able to prevent some cases of autism. We know that families with an already diagnosed child with autism have a 20% increased risk of having a second child with autism. This year, SARRC hopes to recruit those baby siblings, and starting at 6 months of age, we hope to show that less than 20% of them go on to have an autism diagnosis at 18 months. Those who do will have started early intervention more than 4 years before the average age of diagnosis. Second, we need to invest in the expansion of SARRC's most impactful programs to serve more individuals with autism. Expanding SARRC's community school into more Valley locations, for instance, will help us decrease wait lists, increase access to life-changing outcomes, and perhaps even reform education in the state of Arizona, as our data continue to show that our typically developing kids are not only more prepared for kindergarten, they may even be starting ahead of the game. Next, we need to increase and create more inclusive educational opportunities for our families. Special education classrooms and special schools for autism already exist, but high-quality, inclusive general education classrooms are hard to find. Similarly, we need to ensure that individuals with autism across the lifespan have the opportunity to participate fully in our community. At 1 in 68, we don't have enough time or resources to create enough special and separate activities for individuals with autism, nor is that what's best for a population that has a social disorder. Rather, we need restaurants, movie theaters, libraries, museums, gardens, sports stadiums, little leagues, dance classes, bowling alleys, skating rinks, yoga studios, and health clubs to include individuals with autism every day. Finally, we need our employers to work with us to help us shatter the 90% or underemployment rate among our adults with autism. We are facing a public health crisis as 500,000 children become adults with autism this decade. What are they going to do? Where are they going to live? And who is going to pay for it? We can help individuals with autism learn to live more independently and reduce state costs, but it all starts with getting them jobs. We're looking for employment partners who want to work with SARRC so that our adults can be able to compete for the very same jobs and then have SARRC staff provide on-the-job training and support to ensure they are successful. Want to help and not sure where to get started? Consider changing out your current coffee provider for Beneficial Beans Coffee. Hire the Beneficial Beans Cafe to cater your next event or meeting. Purchase baked goods from one of our rising entrepreneurs. Or identify those areas within your business that have the highest rates of turnover, and we'll prepare an army of adults with autism who will show up every day and on time, ready to work, and take pride in that paycheck. And if you're not an employer, please consider frequenting those businesses that are supportive and employing adults with autism. 3 days after the Action for Autism Radiothon, Danny Portillo returned to SARRC to meet with Beatrice Conti to set up a plan. Together, we're developing a treatment program to address Danny Jr.'s communication, reduce his problem behavior, and get him potty trained. But here exposes another gap. Danny Portillo doesn't have autism insurance coverage, nor can he afford to pay for the services privately. Thanks to our friends at KTAR, we got him covered. But there are so many more Dannys we need to help. Here's what you can do. We need to continue to close more gaps and invest in innovation for social impact. Danny Portillo and his family are in for $5. Thank you very much.